First of all, what is diabetes? Now, diabetes is an illness resulting from high blood sugar level due to a shortage of insulin. There are two types of diabetes. You have type 1 or insulin-dependent diabetes, which is found in children and young adults. In these individuals, the body does not produce any insulin. Then there's type 2 diabetes or non-insulin dependent diabetes. And the majority of diabetics are of this type 2 diabetics. Now in these individuals, the body produces some insulin, but not enough for their needs. We're going to look now at the hormone called insulin, as we mentioned before. Now what is insulin? Now insulin is a hormone produced by the body, and it is responsible for the utilization of food to produce energy. In other words, if you don't have insulin in the body, you're unable to convert the food you eat into energy. When we eat certain foods, for example carbohydrates, these are broken down into simple sugars. These sugars are absorbed from the gastrointestinal tract and they go into the blood. Now if insulin is present, the sugars can go into the cells and be converted to energy. If insulin is absent, the sugar cannot get into the cells and the sugar will remain in the blood, and the blood sugar will then get higher and higher and higher. Now let us look at the symptoms of diabetes. Now one of the symptoms would be that you might feel very thirsty, so you will drink a lot of water. So anybody you see drinking large amounts of water, you could suspect for having diabetes. Also, you're always hungry. You're going to pass urine more often. You're going to feel tired, and you may have blurred vision, and you may have weight loss. Even though you're not trying to lose weight, you're losing weight. And you may lose the feelings in your feet, and you may experience tingling in your feet. And if you get a wound, you may have what we call poor wound healing. Now we're going to look at some of the complications of diabetes. The first one we're going to look at is the vision. People who are diabetic are more at risk for having problems with their eyes. They can develop things like glaucoma. They can also develop cataract, and they can get what we call bleeding behind the eyes because of the diabetes. And this could lead to, first of all, you have impaired vision, and if it is really bad, people can actually lose their sight and become blind. You also can get kidney disease if you have uncontrolled diabetes. And this can lead to kidney failure, and as a result of this, the patient may have to go on what we call dialysis, which is a machine that purifies the blood. You have loss of feeling in the feet, and this could result in some serious injuries to the feet and even eventually to loss of a limb. For instance, you may have an injury to the foot because you can't feel, it goes unnoticed. Then it becomes infected, and then by the time you get to the doctor, it is so bad that the foot is gangrenous and has to be amputated. You have fungal infections. Some people, diabetics, they get infections like between the fingers. The women may get yeast infections very, very often, and men can also get yeast infections as well. And these sometimes could be some of the markers that the patient is diabetic. Now, how do we treat diabetes? Now, if you remember, when we started, we said that diabetes is high blood sugar due to a lack of insulin. So if you are a type 1 diabetic, where you have no insulin at all, the only treatment for you would be to administer insulin. And this has to be done under the skin. Now, part of the treatment also would be proper diet. Because if you are diabetic, you have to avoid certain foods that are high in sugars. So proper diet, your insulin, and exercise. If you are type 2 diabetic, the body is producing some insulin, but not enough for your needs. So you may be able to just take tablets, which would encourage the production of more insulin, or in some cases, if your sugar is not controlled that way, then you would have to be given insulin as well. So the type 2 diabetics can either have the oral medication or the oral medication and insulin. As part of the treatment of diabetics, you should also stick to a strict diet where you will avoid the sweet foods. You will make sure that the diet is balanced. You have your meats, you have your vegetables, you have your fruits, and if you're going to have a snack, you make sure it is a healthy snack. Don't snack on things like corn curls and Fruit Loops and all the other sweet stuff. You can snack on like fruits. You also should get adequate sleep. You should also exercise regularly and keep your body hydrated. Drink enough water. Now, a question that you may ask, if my mother or father is diabetic, will I become diabetic? And is there anything I can do to prevent the onset of diabetes? Well, the answer is, if your parents are diabetic, you have a first degree relative that is diabetic, then you are more likely to be diabetic. If you are obese, you are more likely to be diabetic. That is, if you're overweight. Now, some of the things you can do to prevent diabetes, well, you cannot change your family history, that is a given, but you can control your weight. So if you're overweight, you can lose weight. If you do not exercise regularly, then you can change that by exercising on a regular basis. As you get older, you also tend to, diabetes become more common. That one you can't do anything about. And another thing you can do to prevent yourself from becoming diabetic, as a young adult, keep away from alcohol. Because alcohol will damage the pancreas, and this is the organ that produces insulin. So if you destroy the pancreas, you become diabetic. So these are some of the things that you can do to prevent yourself from becoming diabetic. And if you're diabetic, you just make sure you follow the instructions of your doctor and you do the right